For the bridge, I use this the most during primary surgeries. To lift the tip of the nose, hello, I am Lim Gayong-taek, Director of Rhinoplastic Surgery, where we realize beauty. Today we will take some time to look into the materials for nose surgery that many people are curious about and look up before getting the procedure. In the past, there was a time when we used L-shaped silicone to raise both the bridge and the tip of the nose in one piece, but we don't really do that anymore. Generally, we use autologous cartilage or tissue for the tip, and silicone is used only from the bridge down to just before the tip. For the nasal tip, the most commonly used material is your own cartilage. We often harvest septal cartilage, which is located in the space between your nostrils. We also frequently harvest cartilage from the ears. When we need more structural support for the nasal pillar, we use autologous rib cartilage, which is, as the name suggests, harvested directly from your own ribs. Also, if the skin is too thin and soft tissue is needed, we use fascia or dermal tissue. Fascia can be harvested from the scalp, and dermal tissue can be taken from various areas.
For the bridge of the nose, the most commonly used material is actually a silicone implant. Silicone implants are used the most these days, and usually using autologous tissue for the bridge during the first surgery makes the procedure too extensive. So, for materials to raise the bridge other than silicone, you can consider your own autologous tissue, such as rib cartilage or autologous dermis, but each material isn't necessarily perfect. Rib cartilage has the disadvantage of potentially warping, and with autologous dermis, it's hard to accurately predict the absorption rate. So for those who don't have issues with silicone, we usually use silicone. There are also non-autologous materials as well. There are also materials like donated dermis such as megaderm or alloderm, which are processed products harvested from cadavers, but I do not recommend those from the start. And among the materials used in the past to raise the bridge of the nose, there are also materials like Gore-Tex or Siltex, but they are not used much these days. This is because once silicone is inside our body, it maintains its shape without any changes, whereas materials like Gore-Tex or Siltex can stick to surrounding tissues and capsules, and their shape can change slightly over time, so it would be good to know that they are not commonly used materials these days. For the bridge of the nose, I primarily use silicone implants for the first surgery. They are the best for shaping and maintain their form well without any deformation. To support the tip of the nose, I first use septal cartilage as a pillar. Then I use ear cartilage as a cover to make the tip look more defined. These days, many people prefer a very glamorous look from the start, and those who want a firmer feel sometimes ask for autologous rib cartilage, but I don't really use rib cartilage for a first surgery. It's rare to need to raise the nasal tip that much anyway. If you want it, I will certainly do it. When using autologous rib cartilage, even a small scar will form, and that scar needs time to heal, so I rarely recommend it from the start. However, if the septal cartilage is insufficient or too weak, I do occasionally recommend it. Usually, when we talk about implants these days, you can think of them as silicone implants. When we say implant-free rhinoplasty, it means no silicone is used, but it still involves using your own cartilage. So while cartilage grafting doesn't involve harvesting cartilage, if you consider raising the nasal tip, implant-free rhinoplasty is a term that generally includes the use of septal or ear cartilage.
I had a rib cartilage rhinoplasty. When getting revision surgery, do you use rib cartilage again?
If the previously used autologous rib cartilage remains firm, it is best to reuse it as is. However, if the existing rib cartilage is in a state where it cannot be reused, a new harvest may be necessary. But usually the cartilage does not just disappear from absorption, generally speaking. So far, we have looked at the materials needed for nose surgery. In fact, these materials are truly important in rhinoplasty, especially in revision surgery. The difficulty can vary greatly depending on what materials were used previously, whether they can be reused, and if any remain. It is very important to choose the right materials from the first surgery, and it is, of course, just as important for revision surgery. Depending on the changes you want for your current shape, there is a material that is most suitable for that, so it is best to find out through a consultation. If you have any questions, please leave a comment and I will answer them right away. Or if you come for a consultation, I will do my best to guide you in the right direction for you. Please subscribe, like, and turn on notifications.